In today's health headlines, an update on the new mpox strain. We are in the largest COVID surge in 2 years. And what to know about the Zika-like virus that is spreading. There's a lot. Joining me is Dr. Anyima Aguagu, Yale Medicine infectious diseases specialist and associate professor of medicine at Yale School of Medicine. Welcome.
Thank you, Anne.
All right, Doctor, the new strain of mpox spreading in numerous countries is more dangerous than the previous strain. Should we worry about it here? What should we know about this?
Yes, and it almost seems like you can't catch a break with epidemics and outbreaks. And so, mpox has been circulating since 2022. That's when we had quite a few number of global cases. There's still ongoing local circulation in the U.S. I think about 750 cases in the U.S., including 2 in Connecticut just in 2024 alone. Now, that was a different clade of mpox. Think of it as a different variant, if you will. Now, there's another one that's been spreading in Africa that started in the Democratic Republic of Congo. This is a clade 1 virus. And like you stated, this is one that has a little bit higher mortality than the previous circulating strain. And it spread to over 12 African countries, and I think now Spain and Philippines have also reported cases. And as we've seen with prior outbreaks, these viruses tend to spread as people travel and go from different countries. And so I think the message here for the public is that we need to keep our surveillance up, especially people who may be traveling from some of the affected areas. And, regarding how to prevent it, I mean, we have effective vaccines that work. People at risk should receive at least 2 doses of the Jynneos vaccine. Unfortunately, we just learned that one of our therapeutics, antivirals for mpox, did not work to shorten the severity and duration of symptoms. So again, low risk for now, but I think that all of us just need to be aware of it and keep surveillance for new cases.
All right, that's one thing. Now, this summer surge of COVID is the largest wave of cases we've gone through in at least 2 years. What's going on?
Yeah, and here's my worry, though. I think, this was somewhat predictable because, the last boosters that were recommended in the 2023-24 season that just passed, the uptake of vaccine was very dismal. I mean, less than 25%, a quarter of the U.S. population took those vaccines. And so we're in an era where there's waning immunity to the virus. The virus continues to evolve. There's new variants. The KP variant, I think KP3 is emerging as the newest variant that's circulating, which again evades immunity from prior strains and, of course, previous iterations of the vaccine. So with waning immunity, the cases are going up. And my worry is that, schools are opening across Connecticut. We're going again into the fall-winter season when these respiratory viruses take up. So I think we've left ourselves ill-prepared for this, and it's showing up as higher rates of, test positivity, emergency department visits, hospitalizations, and don't forget, 450 Americans are dying every week because of COVID-19. So, just want to put a plug. The next iterations of vaccines for this season, we hope will be available towards the end of August and onwards. And really just to remind everyone, particularly elderly, immune-compromised individuals who are most vulnerable and people with underlying medical conditions, please take those vaccines when they become available.
And just real quickly, a Zika-like virus is spreading. What should we know about this?
Yeah, I mean, we've had a lot of rain in Connecticut, and I think many of us are seeing, changing climate patterns, even in our parts of the world. And so, in Central and South America, they're having a virus actually which is endemic there, but again, I think has had a spike of cases recently. Is acting like Zika because it appears to affect pregnant women, and pregnant women are transferred to the offspring with, adverse fetal outcomes as well. Not a concern, except that I think Florida, for example, has reported some travel-related cases. So I do not, we've talked about a lot of maybe concerning things, but I think this is something we probably should not be concerned about much in the U.S. yet. But again, of course, surveillance for travelers to that area, and maybe if anyone from Connecticut or somewhere is planning to travel to some of the affected areas, particularly Cuba, probably not the best time to do that. And just one last thing to say is with the rains we're having, stagnant water is a reservoir for mosquitoes, and there's so many other mosquito-borne illnesses that circulate. And so I think we just need to really pay attention to our environment and try to stay safe.
Okay, one day at a time. Dr. Aguagu, thank you so much for being here.
It's a pleasure. Thank you for having me.
Take care.